All right, today we're going to do something a little different. We're going to take a health check on the entire European Union, focusing on its very heartbeat, right? We're talking about cardiovascular health. There's this new, huge report out, and it gives us this incredible look at what's really the continent's biggest health challenge. So let's just dive right in.
Okay, so here's the plan. First, we'll get a sense of just how big this problem is. Then we're going to untangle this web of hidden risks causing it all. After that, we'll see what the healthcare systems are doing on the front lines. And to finish up, we'll look at the roadmap for a healthier future. Sound good?
All right, first up, Europe's ticking heartbeat. Let's really get a grip on just how serious this is. And look, this isn't just going to be a bunch of dry statistics. We're talking about millions of real people, real lives all across the EU.
Okay, let's start with a number that, honestly, it's pretty shocking. 22%. Just let that sink in. Nearly 1 out of every 4 adults in the EU, 15 and over, has high blood pressure. Think about that. You know, they call it the silent killer for a reason. You often don't feel a thing, but it's the #1 risk factor for heart attacks and strokes. This is the ground floor, you know? This is the reality we're starting with.
And behind a huge number like 22%, there are millions of individual stories, right? People like Kayas. He's an artist, a researcher, and a heart attack survivor. His story is all about how timely care, that swift decision to get him the help he needed, literally saved his life. It's just such a powerful reminder that when something like this happens, every single minute is critical.
Okay, so just so we're all clear on the terms here, when we say cardiovascular disease, or CVD, what are we actually talking about? Well, it's not just one thing. It's really a whole group of disorders. Think of it like an umbrella covering everything to do with the heart and blood vessels. So coronary artery disease, stroke, heart failure, it's all in there. And the primary risk factor, that silent killer we just talked about, hypertension.
Okay, so we've got a sense of the scale of the problem. Now the next big question is, why? What's causing all this? It's so easy to just say, oh, it's about diet and exercise, right? Your personal choices. But the truth is, it's so much more complicated than that. It's like this massive interconnected web of hidden risks.
So this report does a great job of breaking it down into 4 big categories. First, you've got the stuff you'd expect, clinical factors like hypertension and cholesterol. Then, lifestyle factors, diet, smoking, you know the drill. But then it gets really interesting. It dives into environmental factors like air pollution and socioeconomic factors like your education and income. Turns out, where you live, what you do for a living, even the air you breathe, all of it is tangled up with the health of your heart.
And this is where you really start to see the huge inequalities at play. Just take a look at smoking. In countries like Bulgaria and Greece, over 23% of people smoke daily. But then you look at Sweden, and it's less than 12%. That's a massive difference, right? And it's not an accident. It points to huge variations in policy, culture, and just the general conditions people live in. It really hammers home that old saying, your zip code can be just as important as your genetic code.
And you know what? It's the exact same story when it comes to diet. We all know that unhealthy diets are a major driver of heart disease. No surprise there. But the problem is that not everyone has the same access to things like fresh fruits and vegetables. The consumption varies wildly across Europe, and that creates these deep health divides, not just between countries, but even within them.
But the good news is there are some really smart solutions out there. Take Spain, for example. They've passed a royal decree, basically a law, that promotes healthy and sustainable eating in all schools. This is genius. It's not about just telling people what to do, it's about changing the system from the ground up. You're tackling the problem at its roots and setting up the next generation for a healthier life.
In this slide, wow, this just lays the socioeconomic link bare. The numbers don't lie. If you look at people who use primary care, those with a lower level of education have a CVD prevalence of almost 23%. For those with higher education, it's just under 20%. And listen, this has nothing to do with how smart someone is. It's all about something experts call health literacy. Basically, your ability to find, understand, and then act on health information. And of course, having the money and resources to actually do it.
And here's where the human stories come back in. Antonis, who lives with congenital heart disease, really drives this point home. He talks about how these socioeconomic factors hit people differently and how gender plays a huge role. He points out that men are often at a higher risk, but they might also be the ones who ignore those early symptoms, you know? Sort of a tough-it-out mentality that can lead to dangerous delays in getting care.
Then you get Angela's perspective, and it's just so important. She lives with multiple chronic conditions and highlights the completely different hurdles women face. It can be a lack of health literacy or simply not having the money. But it's also about having your own experience invalidated, being told you don't look sick. It's a powerful point. These pressures, these barriers, they are absolutely not gender neutral.
Okay, so we've dug into the risks. It's a complex picture, right? So now let's shift gears and look at the system on the front line. How are healthcare professionals and systems across Europe actually fighting back against this?
Well, one of the biggest challenges is that you're often fighting an invisible enemy. Remember hypertension, the silent killer? It's the #1 risk for stroke, but millions of people have no idea they even have it. So the question becomes, how do you fight something that's literally hiding in plain sight?
Well, here's one great idea. You take the fight to where the people are. The UK has this fantastic campaign called Know Your Numbers, and it's so simple, it's brilliant. Instead of waiting for you to go to the doctor, they bring blood pressure checks out into public spaces. They make it easy, they make it visible, and they make it accessible. It's public health at its best. But a really effective response isn't just one single campaign. It's more like a whole chain of care, a continuum. It has to start way before there is a problem, with prevention and early detection. Then, when something does happen, you need top-notch acute care. After that, solid rehabilitation and long-term management. And you know what's tying all this together more and more? Digital health.
But here's the thing. When you look across the EU, it's not a unified system. It's a patchwork. You can see it right here. Countries like Finland and Spain, they have it all covered. National plans for CVD, for stroke and disease management programs. But then you look at France or Germany, and you see gaps. This kind of inconsistency creates real disparities in care from one country to the next.
And speaking of that digital health piece, let's look at a real-world example of what great looks like. In the city of Oulu in Finland, every single resident can use this digital self-care service portal. Think about that. It gives you your own health data, connects you to doctors and nurses, and it all feeds directly into your electronic health record. This is what the future of integrated, tech-driven healthcare can be. So, with all that in mind, what's next? Where do we go from here? What's so great about this report is that it doesn't just point out all the problems. It actually gives us a clear, ambitious vision for designing a healthier future for heart health in Europe.
And the path forward, at its core, is actually pretty simple to understand, even if it's a huge task. It all boils down to an approach that is coordinated, that's driven by data, and, this is the most important part, that's centered on people, on their needs, their experiences, all the way from prevention right through to long-term support.
And this whole vision rests on 5 key pillars. First, strengthen primary and community care, the front lines. Second, prioritize health literacy and prevention. Third, actually implement shared decision-making. That means you and your doctor decide together. Fourth, leverage all this amazing digital health and data we have. And finally, and this is maybe the most crucial of all, ensure equity. Make sure no one gets left behind, no matter who they are or where they come from.
And that brings us back to Caius, the heart attack survivor from the beginning. He's an artist, a researcher, and now a patient advocate. And he leaves us with what might be the most important message of all. He says that listening to patients, to their lived experiences, that's the key. You have to create policies with people, not just for them. Their voice has to be at the table. It's that simple.
So there it is. The blueprint for better heart health in Europe, it exists. It's not some far-off dream. This report shows us it's actually an achievable goal. The evidence is there, the roadmap is clear. The only question left for all of us is, are we ready to build it together?